Let me start with Erin Russo. Let me introduce Erin Russo, who is Director of Clinical Education for Memorial Health, an independent health system in Marysville. She's been on the nursing staff at Memorial for 17 years and has more than 15 years of critical care experience. For her current position, Erin was an ICU floor nurse and worked with a hospitalist team. As Memorial progresses through the pandemic, Erin is a frontline resource for the nursing teams at Memorial. Erin, thank you very, very much for joining us. We appreciate it. Tell us a little bit about what you're seeing. Thank you.
Thank you for the opportunity to speak on behalf of nurses everywhere. And I just want to applaud the team that I'm on specifically because they've been troopers through all of this. We're seeing what your data is reflecting. We're seeing our highest volumes to date for COVID patients coming through our ER and then requiring inpatient admissions. And some of those their disease processes are progressing into needing critical cares. So definitely it's reflective of the data that you speak to. And I think the unfortunate piece is to kind of compound the issue. We're also in our kind of high tide period in the Midwest where hospital census is typically high and expected to be high without the effects of COVID, without that population also marching into the building. So I think that's a compounding factor for sure.
And what are you seeing from patients coming in? I mean, just give us a little human side of this, because sometimes we look at, I talk about numbers and Erin, it just, what matters is people. And maybe just tell us kind of from your perspective how this impacts the patients, but also maybe how it impacts you and other healthcare workers who are literally on the front line.
Yeah. Well, I've said it before that we've likened this to the comparable illustration of running a marathon. And I think since dealing with this since March, I would escalate that comparison to that of the Iditarod. And honestly, the dogs are tired. Endurance is finite and nurses are human. We're dealing with the added stress of working long shifts, and that's not something we're strangers to, but we have coworkers that are in quarantine. Our community exposure it also affects nurses. So our staffing is feeling that stress as well. What we found in March, I think our original worry was, of course, how are nurses going to keep their patients safe, and then also what we do when we go home, how we keep our families and friends safe. And that was a definite stress that we were walking into with a lot of unknowns. And I think also at the beginning, we were concerned about PPE and having enough ventilator support and creating spaces that could handle surges. And what we've learned is we can manufacture equipment and we can manufacture supplies and we can create spaces to place beds and put people in. But what we can't manufacture are staff members that are skilled enough to care for those patients that we're seeing influx into our facilities. And this is happening on such a grand scale that even our tertiary neighbors, where larger hospitals that we might depend on to divert our own patients to, are also filling up quickly. So our most unsettling fear is the fact that we could have the threat of patient care being compromised in some way. That happens when staffing gets slim and stretched. Nurses have been leading the forces and medical teams altogether, the physicians, the ancillary departments. It's been a team effort for sure, but we're tired. Patients, it takes a lot to communicate with PPE. Patients are looking up in their beds and they're seeing people come with hazmat suits on, and a lot of patients don't know why they're here or what they're here for. And we're seeing elderly populations that deal with dementia, and they're having trouble hearing us and we're having trouble communicating. And we're in emergency situations where our communication with each other is essential in order to make these things happen for the best outcome of our patients. And it's just, I don't know that I can articulate what it feels like for a nurse and our ancillary staff members to have that barrier and just continue on. But what I think's happening also is we've been in this Iditarod, in this long marathon of a race, and we see the blizzard coming. There is a tidal wave coming. Our numbers are supporting that. We've had, a high influx of patients that definitely support what you're saying. And there's ways that we can stop the pace, and our hospital is doing phenomenal job working a lot of hours to try to support those plans. But the blizzard and the tidal wave feels like it's coming to us, and that gives us great anxiety.
So thank you very, very much. And last question, how are you doing?
We're doing okay. We lean on each other. I think it's a year we'll never forget. But I think a lot of us are trying to gear our perspective toward answers and an end in sight. As you said, it feels like the finish line has moved every month. And like I said, we're tired, but a nurse in our essence, and I'm speaking on behalf of nurses because that's what I am, but I think physicians, and like I've said, all of our entire team, the reason we walk in these doors and take on these sacrifices is because we care about the patients lying in the bed, and we will we'll keep running the race for sure. But it would, to have the support of community members that are taking these small steps to help us pace along with these surges. They seem like minuscule tasks, but to us, it can make the greatest difference.
Well, thank you. Please tell everyone on your team, thank you. We are very, very grateful. None of us, unless we are there, really understand. We can say we understand, but we don't. We have some idea, but we don't really fully understand what you're going through. So thank you very, very much for what you do every single day. We're very grateful. Please pass that on. Thank you. Thanks for joining us today.
I absolutely will. I appreciate the opportunity.
Thank you.
Stay safe.
Thank you.